Hello, everybody. This is the population level health education intervention presentation. My name is Christine Velasquez. Introduction. This project was developed with the study and comparison of two different communities, one in Temple City and one in Walnut Park. The focus of this project is providing an intervention in the underserved population of Walnut Park, specifically its adolescent population. So four health-related problems were number one, diabetes, number two, nutrition and weight status, number three, injury and violence prevention, and number four, substance abuse. And these are all found on the Healthy People 2020 website. But these were the four that I found most represented the problems in Walnut Park. Background and significance. Several overarching issues and factors have influenced the nutrition and healthcare choices of the citizens of Walnut Park. The cause of poor nutrition seemed to be the lack of healthy options and the abundance of liquor stores and small markets that sell processed foods and snacks. In addition to poor food options, there seemed to be a lack of safe spaces for children to play and lead active lifestyles. The Hispanic Americans have disproportionately higher rates of obesity than all other races and ethnicities. Nutritious diets and weight control are essential in preventing major health problems such as diabetes, so this is why it's so important. And concerns of the parents and community members of Walnut Park include allowing children to be influenced by dangers of the street, such as drugs, gangs, and prostitution. So many community members felt embarrassed that their city is known as a prostitution hub, and so they feel that they have no control over crime with little to no help from local authorities. So these are some of the issues that were brought up by community members of Walnut Park. Healthy People 2020 objectives. Number one, diabetes. Reduce the annual number of new cases of diagnosed diabetes in the population and increase prevention behaviors in persons at high risk for diabetes. Nutrition and weight status. Increase the number of school districts that require schools to make fruits or vegetables available whenever other food is offered or sold, and reduce the proportion of children and adolescents who are considered obese. Number three, injury and violence prevention. Reduce fatal and non-fatal injuries. And number four, substance abuse. Increase the proportion of adolescents never using substances. So needs assessment. For this project, key stakeholders and community members were interviewed. An academic administrator, Francisco, and a local priest, Julio, were the key stakeholders who offered information, as well as multiple parents and students from Walnut Park Middle School. I also conducted a windshield survey of the community in order to gain an understanding of the available resources or also the shortcomings within the community. Based on the lack of resources, financial instability, and time constraints rather, the families of Walnut Park face problems of basic necessity. Families with middle school age children tend to focus their resources on safety from threats of the streets, and therefore overlook important health issues such as poor nutrition, which can lead to the development of diabetes. Families of Walnut Park struggle to survive by taking on multiple jobs and are forced to reserve less time for regularly cooking proper meals and health-related activities such as regular checkups and participation in exercise programs. Furthermore, middle school age children are rarely taught to make health-related decisions on their own, but are expected by parents to know how to make the best decision without prior knowledge or resources. So this is how I identified the needs of the students of Walnut Park Middle School and how they need to be taught how to make these decisions for themselves. Theoretical framework and needs assessment. So PRECEDE stands for predisposing, reinforcing, and enabling constructs in educational environmental diagnosis and evaluation. As its name implies, it represents the process that precedes or leads up to an intervention. PROCEED spells out policy, regulatory, and organizational constructs in educational and environmental development. And true to its name as well, describes how to proceed with the intervention itself. The PRECEDE-PROCEED model views health as a community issue that is heavily influenced by the surrounding beliefs, attitudes, and environment of their community. The model aids community health nurses in assessing the population in order to effectively implement health interventions aimed at the population's negative health behaviors. The PRECEDE-PROCEED model helped me in deciding to educate the middle school students of Walnut Park on healthy behaviors regarding diabetes prevention and choosing nutritious meals. The model also provided a framework for how to best implement this education through extensive assessment of the community and their needs. Issues. Specific barriers to the healthy eating and diabetes prevention in Walnut Park include a major lack of large grocery stores that offer health foods and the abundance of liquor stores that sell processed foods and snacks, an abundance of fast food restaurants, a lack of community health programs, and limited access to designated areas for physical activity. So given these limited resources, the middle schoolers of Walnut Park need to be educated with real-life application of how to choose the best meal options to eat nutritiously and prevent diabetes. Community services such as access to safe parks and recreation services are vital in promoting physical activity to prevent obesity and diabetes. And education on healthy food choices that engage middle school age children are essential in promoting healthy behaviors. So in this slide, I included a photo of choosemyplate.gov, which shows what we are currently using to help students or help people really apply the food pyramid. Yeah. So intervention. The identified health-related problems of Walnut Park Middle School students include proper nutrition promotion and diabetes prevention. I set out to implement 2 educational presentations, 1 per topic, in order to teach and promote healthy behaviors. So for the first one, diabetes prevention, I presented a PowerPoint and created a handout that informs students of what diabetes is, how it is caused, and what behaviors can prevent it. The handout also included added resources of nearby programs aimed at diabetes prevention, and students were encouraged to share the information with their families. Students were surveyed for their knowledge on the topic before and after the presentation. So basically, I asked for student participation and asked, what have you heard of diabetes? What do you know? And then I also did the same thing at the end of the presentation, and there was some student participation. Healthy People 2020 objective that I'm aiming for here is to reduce the annual number of new cases of diagnosed diabetes in the population and increase prevention behaviors in persons at high risk for diabetes. So on this bottom of the slide, the choose this, not that is what I included, is part of what I included in the handout that I created for these students. Interventions continued. This is number 2, and the second presentation was on proper nutrition. And I presented a PowerPoint that focused on the 5 food groups and the utilization of MyPlate in order to address proper nutrition. I provided examples of how MyPlate can be applied to school meals, since the students have the majority of their meals at school and have the ability to choose what foods to consume from their lunches. I also incorporated the school lunch menus to test the students' ability and apply what they learned and to further reinforce the concepts of nutritious eating. So on the bottom left is the December menu. What I actually did in the presentation was I gave them the November menu, and then I went over 1 week of what were the best options or the healthiest options that based on what was provided by the school. And then I handed out the December menu and had the students choose what they believed were the best options or the healthiest options for another week in December. So that way they kind of already know beforehand what they should be choosing. So the Healthy People 2020 objective here is to reduce the proportion of children and adolescents who are considered obese. Also in my presentation, I included the MyPlate guide, and this one here is for school breakfast. I included the breakfast and the lunch one, which shows a typical school lunch or school breakfast and what it should look like and how it incorporates all the different food groups. Budget. The intervention's only costs came from the materials needed to print and disseminate the handouts to the middle schoolers of Walnut Park Middle School. This came out of my own pocket as I printed the materials at home. The total cost was roughly $40 for ink and paper needed to make 50 copies of the handouts that were distributed to students. Each student that attended the presentations at the Educare Foundation's after-school program received a handout, and the rest of the handouts from the 50 were given to the program director for further distribution. Costs to further implement the interventions include salaries of staff that must be trained to present this information and funds needed to print the materials that were handed out, including the menus. Project evaluation outcome measurement. So for the diabetes prevention, my goal is to promote community-wide awareness prevention through the development and utilization of an active lifestyle program. Objectives were students will give 2 reasons why diabetes have negative health consequences. Students will name 2 factors that can cause diabetes. Students will identify 3 ways to prevent diabetes, and students will teach at least 1 other person about what they learned regarding diabetes prevention, hopefully their parents. Outcome measurements I used the pre-test and post-test that were conducted verbally with student participation. I'll talk about this later as actually kind of being a weakness of my presentation because I think it would have been better if I put it on paper. So nutrition promotion, the goal here was to promote community nutrition and a health conscious environment through the application of healthy food choices. So my objectives were students will identify at least 3 healthy food options provided by their school. Students will identify 2 ways they can eat healthier at home, and students will demonstrate healthy food choices using their school lunch menu. And students will pledge to make at least 1 healthy change to their diet. So students were tested on their gain knowledge by evaluating their ability to apply the concepts to their own school lunch menu. I actually found this to be really good, and it helped reinforce what they learned in that presentation. So I really like that. Results and conclusions. Overall, the project was successful. Students demonstrated gain knowledge of diabetes and how to prevent it. The handout seemed to catch the students' attention due to the use of many pictures. The majority of students demonstrated an understanding of MyPlate and the food groups through their ability to pick the healthier options from their school lunch menu. So I think all the handouts, the one that I created and the menus seem to be a really good teaching tool. Weaknesses in the project included the need for more time in discussing the topics, especially in discussing what diabetes is and how it works in the body. That was part of my first PowerPoint on diabetes, and some students I could tell didn't truly understand that information, even though I try to make it as simple as possible. Maybe using an analogy would have been a little bit better in that situation. Another weakness was not having any incentives to promote participation from all students. So again, the way that I had asked questions, or let me continue. I believe including a better way to measure student learning in the diabetes presentation would be beneficial rather than depending on student participation. So here, yeah, I would also suggest incorporating prizes to gain more student participation. I thought about it afterward and thought about including like healthy snacks as prizes to promote participation and actually have a better way to assess their learning instead of just having them raise hands, because some people can be shy and it's not a good representation of what they've learned. Here are my references, and thank you for watching.